Our hope is that today would be, or this afternoon will be an opportunity for some questions and answer time with Dr. Hsaio. But I think what we saw this morning in the presentation was an outline of the failing nature of our healthcare system now. The fact that even under the federal healthcare bill, 32,000 Vermont residents will remain uninsured, and another 15% of Vermont residents will be without adequate health insurance. And even under the federal legislation, we will continue to have rapid cost escalation, such that we can expect that the number of uninsureds and underinsureds will increase. That's simply unacceptable. What we believe is that the principles that Vermonters expect are universal coverage, a containment of costs, and maintaining and improving the quality in our system. We believe that the outline that Dr. Hsaio provided today in his report meets those principles and moves Vermont forward. Failure to act, I believe, will be a failure of the system. Dr. Hsaio, I think correctly today, pointed out that if we do not act now, it is likely that we will be back here 5 years from now, even with the enactment of the federal legislation. It's my hope that some of the initial questions that are raised by the report that was seen today can be answered by Dr. Hsaio. But let's remember that this is the beginning of a process, not the end. And we will take the report that's been given to us. It has already been put forward to the committees, and we will start working on it immediately, working in concert with the Senate and with the administration to move forward this year. And I'll turn it over to the President Pro Tem.
Thank you, Speaker. One of the things that it's interesting about this whole situation, and as Dr. Hsaio had pointed out, the unsustainability of the current system that we have. And so our job here is not just to take care of us today and the citizens of Vermont today, but also of future generations of Vermonters. This really is the core. We need to understand our responsibility to our children and our children's children. And one opportunity that I see here is the fact that I think we all know that far too many Vermonters have been using our emergency rooms as their primary care docs. And one of the reasons is because we have so few primary care doctors in Vermont today. And this is a problem that not only exists in this state, but across the country. And I'm hoping by the plan that we're able to implement, or the plan we're able to develop, that we recognize the importance of primary care physicians in maintaining the health and welfare of all Vermonters. And so key parts will include, of course, realizing the economic side of this, but also we'll take into consideration how we need to go ahead mechanically in the future to provide quality health care to all Vermonters. And as I said once before, too, as I believe that health care is a right, but as with other rights, there's also responsibilities. And those people who are here in Vermont, hopefully we will have in this new system, everyone will recognize the importance of preventative care and will take that upon themselves, not only for their families, but also for their families' families. So thank you very much, and right now I'll give you Dr. Hsaio.
Good afternoon. You are glutton for punishment. I assume most of you were there this morning. And the speaker and the President Pro Tem already outlined about the major points why you need to reform your health system. And I can say with full confidence, your broken system can be fixed, but it requires you to have that determination and also to adopt the right solution. And in my presentation, I already outlined we will recommend option 3, and I already gave the reasons, as well as outlined that option will achieve what you specified in Act 128, which is universal coverage, covering every Vermont citizen, and to raise everyone's insurance benefit package to an adequate level, and control the cost escalation, and also build up the supply side. And even with that, our proposal, most Vermont employers and workers will pay less, and also it will generate new jobs in Vermont. So I think with that, I open up to your questions. And
if you work for a company based out of state, let's say you're a UPS driver, UPS is headquartered in Stamford, Connecticut. They, I'm sure, negotiate a health insurance contract with one of the big health insurance companies. What would happen to that UPS driver and UPS, and how would that work? How would that be incorporated into the Vermont system to that driver who lives here in Vermont?
You're talking about a Vermont resident
Driver
who is working for
an out-of-state company.
Right. In that situation, two things can happen. One is that person can continue to be insured under his or her current plan, but preferably it will be that we propose Vermont actually asks the employee to pay a premium payroll contribution, and that's collected by, let's say, the employer, which is our state. And in our analysis, we understand that's allowed. So you can, and then that employer can decide whether that employer will contribute his share and include the employee into the Vermont single payer. But even if the employer does not change the plan, for that worker, the worker will still be assured covered in the Vermont plan.
Would that employer then be required not to charge the worker, or let's say the employer was previously buying health insurance, providing health insurance through Blue Cross Blue Shield, would that employer then be required not to charge that worker the monthly share of the premium for Blue Cross Blue Shield and allow the worker to exit the Blue Cross program, and otherwise the worker would end up, I assume, being double billed, once for Blue Cross and once for the Vermont plan?
Yes, that of course is really the labor and management relationship, and I think that would have to be treated each case on its own, and we think that this is kind of the wrinkle that the employer could advise the legislature in drafting a law to implement this.
Just so I'm clear, I think he's talking about a UPS, so a UPS worker who lives and works in Vermont, they would be subject to the payroll tax regardless of whether they took the insurance from their employer. Is that what I heard you say?
Right, I'm saying the employee will still have to pay the payroll contribution, and the employer can choose to say, okay, now you are covered under Vermont single payer plan. We are going to then not give you the regular benefits except the wraparound. And or the employer can say you're covered under both. That means extra payment.